League of Women Voters. The Common.
Water would be okay? Oh, water. Yeah, the water. No, water would be okay for the time
Just
being.
not Diet Coke.
But water only.
So she said
Well, she could do less games. Yes, yes.
Alma, how do you turn this on?
it should already be on. So he can hear us. Yeah, he'll just do a sound check.
And I'll boost you up as you talk.
Please, I'll give you one of these. Yeah, sure.
Hello? Testing? Do you hear me?
Nice to meet you. I think I saw you in a number of like some Udipo.
No, you didn't. You didn't. But my brother-in-law's been talking about Tracy Deal because he just went and spoke
It's on the map.
He's in the
tree
tree
board.
board.
Yes, yes.
Oh, I see. They all got switched. Okay, here.
Do I need to do anything specific?
My district.
No, you just clip this on anywhere on camera right now.
Does that work?
Is it hot? Oh, I shouldn't say anything bad. I'm on a hot mic.
Testing? Oh, yeah. I got mine. I got mine.
How does it turn out?
We'll just do a few minutes.
Hey, how's it going? How you doing? Doing good, doing good.
All right.
I gotta go into the panel here.
They voted to, so now
Wait a
it's
few
about
minutes.
coming to the table and negotiating, right? Which is can be the tricky part.
Right by that button, that part right there.
And I'll talk a little bit about some of our organizing
that good?
efforts at
You're a
Chinese
patient.
Hello, everybody.
that
patient
sort of
too.
came to a crux,
Yeah,
but without
my
numbers, it's
PCP
really
went
hard
on
to
maternity
be ready
leave.
to do things like
I was afraid
work
she would
anymore.
come back.
Right?
And
To
hopefully she
retire
will now.
after a certain amount of time because the pressure has gotten to be too
To get people to join, get community involved in the board. And then I told her, once you have
Great to see you.
applications
Take care.
ready. So she really wants people to demographically represent the patients who work
well,
on
and there are,
But,
I mean, the nurses
it.
can't strike,
Community
right?
input.
You
Have
doing
the
okay?
board
This
reflect
is my husband,
the community.
Pascual.
How are you?
Let me go grab. I'm gonna go grab
Testing,
one
testing,
more
1,
flyer.
2.
Give me- voy a ir al baño y voy a agarrar un agua, pero
Why don't you
no
have
más.
it there? 'Cause there's some people that
My
probably would
Mine
want.
doesn't seem to be
charging back there.
working.
There's one for you.
So I,
Oh, I didn't know, and so le pedí al de él. It's on a chair over there.
Your mic is working?
Mine is, yeah, I tested it a little bit ago.
This one doesn't seem to be.
Oh, he has to turn it on from the back. Yeah.
I'm also kind of behind the table there, but
Okay.
kind of peek over. But I'll turn you up.
Oh,
now.
this is on here. So
Oh yeah, it's on. You don't do
and I
anything
can
else,
leave it
yeah.
on the
Oh,
table.
absolutely, yeah. You guys should all be on. I'll just unmute. I had you muted earlier.
I'm going to start by introducing Dr. Bessie and then hand it over to him.
Oh, so
Right?
good to meet you.
So,
Sure.
respect.
I don't have any agenda.
Okay, so I went and looked at word composition, and I was gonna get you more of a like,
What a turnout.
it's this and that. It is.
So far, so good. And it's Santa Fe. It's not even 3 yet. Everyone comes 20 minutes later.
Well,
Yeah,
let
more
me
people.
speak to this. I mean, understand this a little bit. That I was gonna try to talk about word composition, but like, technically it is got a number of Hispanic people on the board. But they're not really the demographic of the most vulnerable population in Santa Fe, of the Spanish-speaking, primarily undocumented immigrant. So I think that's, yeah, like I've been pushing for years. I mean, don't use my name, but say,
I don't know if there are people who speak Spanish or not.
you can say this,
You're bilingual.
44%, I don't know if this is, about 40%
Well,
of
I
our
think you are.
patients are
From what I can
Spanish-speaking,
I'm not.
prefer to have their
You're
parents.
not fluent in Spanish?
And about that number, 30 or 40%, have been
say things like the group of people who
track that
and I
obviously.
was just informed. I was told by one of my patients was informed that administrative data. And somebody else,
So it would be nice to have some
Alma said it was nice to see
of
these.
that population.
I don't know these things.
You
Anyway,
know, Alma and probably gonna need another chair.
This will be yours. Would you be able to clip this on your shirt? Sure. Oh, sorry. Backwards. Here you go.
Is this close enough?
That's perfect.
Is
so you're Elijah. Thank you.
yeah, Alma Alma Castro is also on the panel.
So we need another chair.
We'll need one more chair.
So I can get a chair for Alma.
Basically, the theme of this is to get more community participation on the board. Is that true? That's what Wendy told us.
Yeah, I don't know who's going first, who's going second,
Do it. I can let you do it.
I think I'm supposed to moderate.
and who's supposed to go first.
He's
Bussy.
gonna open it up. I have no idea why I'm here, basically.
Okay. Thank you for being here.
Yeah, you know what you're doing.
But anyway, Wendy,
Do we have an order of speaking?
No, it's whatever you guys want. I don't know.
how about we do
But
this?
Alma's
We'll do
up here
Alma,
too, right?
Sue,
Yeah, we're
and
getting
Sam.
another chair for her.
We'll do Alma, Sue, Sam. 5 minutes to start.
I got
Okay.
4:30.
Okay, this is.
Oh, you do?
You're
Oh,
gonna
okay.
kick this whole thing off.
Because that was when Saving Private Ryan came out, and I said, prompted it. And they turned it down at that point. They said they did enough stuff with Saving Private Ryan. And then on a whim, about 10 days before Veterans Day of the year, I sent it in again. And they picked it up, and I broadcast it on Veterans Day. It is just timing, yeah. And not being afraid to be rejected. Yes, right. Oh, thank you. No. It's almost like, I go to a woman, Diva, D-I-V-A, she's over in, she's been there for years and years, over in Casa Santa Claus. She's upstairs. It's in Islam, it's called Diva. Her name is Marie Desgeorges, D-E-S-T-E-O-R-G-E-S. Yeah. Thank you. She does a really nice job. Yeah. Thank you. Let's see. Where's Rachel?
For you, we need to ask if people need Spanish. Translate. If needed, yes, but I think yeah, and
Before this starts, I'm gonna just ask if anyone needs Spanish.
Sure. Oh,
I can also
interpreter.
project.
Interpreter. There's a
we have some
microphone
folks
there.
who are quite competent.
Yeah,
I wonder if Eric
I'll
would be.
I'll do that before we get started.
We're gonna start I'm gonna start it. So,
Okay.
but I want Rachel back in here.
So she
Yeah,
is
well, we got
telling me
50,
that's
we
her
got over
chair.
50 people
Okay.
here.
Lynn Raymond is the office manager, opened the place up and got it ready, and Elijah is the communications guy. Thanking them.
And then we're gonna
Ask him.
1, 2, 3.
Okay.
Then I'm gonna ask you a question.
Wow, pretty good turnout. And Rita and her sisters are coming. Rita went to go get her. You know, she's breathing in the wheelchair.
Yeah.
And she wanted to talk about
Where's Rachel? Just grab her. Just grab her.
Amy Carano was her daughter.
Want me to grab her?
Yeah, I texted Amy after I texted
Yeah,
you.
she's doesn't realize. I think you should just grab her.
Well, you know, she told Socorro, if things change around here, I would like to come back.
She
told her
instigated.
that when she left.
She instigated all things, Rachel. She does this. We were up at Rehoboth
Loved
and
her. She was such a, oh my God.
She is really
would,
good. And
she'd
she's,
call her after
Gallup, and
hours
she
and
did
see
a
what she was
similar
doing.
thing. We had 100 people in.
Just,
she's got a
And it's the same issue too. The board was bad. They fired somebody. It's almost a carbon copy. You know,
yeah. I mean, we
that's
just,
the way it is. But this is it.
Good afternoon. Good afternoon. I just heard from Rachel Flores that we're ready to roll. I'd like to just take a moment and welcome all of you to the United Church of Santa Fe. I am Reverend Talitha Arnold, the pastor for the church. And this afternoon, also our office administrator, Lynn Raymond, is here managing managing all of you and to be able to host this meeting. So we're very glad that we could host the meeting here. The United Church of Christ is part of a tradition known as the Congregational Church that has put a real emphasis on the life of a community, not only the church community, but the wider community as well. And oftentimes our sanctuaries double as community meeting spaces, hence the sanctuary here today. We thank you very much for not bringing food or drink into the sanctuary, because even though it's a meetings place, it's also our very sacred space. Mm-hmm. And so there's lots of good things after the conversation is over that you can enjoy out in the community room or elsewhere. Also, the restrooms are the other side of the community room to your right, and otherwise make yourself at home. We're United Church of Santa Fe has had a long relationship with La Familia. We have people in the congregation who have served on the board over the years. We've also had a number of doctors and current doctors who are part of the congregation who serve, doctors and nurses who serve at La Familia. We're very glad for the witness and the work that La Familia has done down through the years, and we hope to be as supportive as we can in this time of challenging transition. So you don't need to hear anything more from me other than welcome. We're really glad you're here. Thank you.
You wanted to say it? Okay. Huh? Go.
We're grateful to the Reverend Lynn for supporting this cause. When we were searching for a place, they stepped forward and said, our doors are open to you, so we thank you, and it's a pleasure to be here. It's an honor to be here with the community of Santa Fe. My name's Rachel Flores. I'm the organizing director for the Union of American Physicians and Dentists. We're sponsoring this community event today, and thank you everyone for taking time out of your day. This is an important issue, and I see that it is an important issue to you and the folks that are watching online as well. I would like to introduce our union president, Dr. Stuart Bussey. He's been our president for a decade and more, and I'm grateful because Dr. Bussey allows me to do this work. These are causes that are important to us. This is what healthcare is about, coming into communities to make sure that communities have access to patient care. So I'm very thankful that we can do this. And for everyone that has supported this town hall today in one way or another. Dr. Stuart Bussey.
Oh, okay. You want to say
Oh, there you go. Okay.
Just one thing. Is there anyone here? ¿Hay alguien que necesita interpretación en español? Levanta la mano. Nadie. Okay. We'll continue in English.
Okay. All right. Thank you, Rachel and Alegre. My Spanish is pretty rusty. Hace muchos años que estudié en Miami. But my best experience over the last 40 years, as you can see, I'm a mature person here, is when I worked at the National Health Service Corps, and I was the only town doctor there. So I knew what community meant something to me. It means something to everyone who works at La Familia. So it was very sad for me to when we got the messages from some of the providers at our union that they were being burned out, and that the goals that they had and the behavior that they did for many years was being subverted by the new administration that came in and want them to turn it into a assembly line. And that's what we're hearing all over this country, whether it's in Mexico or Boston or Washington. Medicine has turned into an industry. And, you know, there's only $4 trillion involved in it. It's right behind the military complex. So there's a lot of reason for people to get involved. I'm not saying that the administration, La Familia, is that way, but there's a balance between the community. It used to be doctor-patient, right? I've been private solo practice for 37 years. I still see patients. I'm going to see patients tomorrow. And there's a sacred bond between that. You know, you come into me, you say you got a stomach ache, it becomes Sherlock Holmes. It also becomes, you know, I want to make, you know, show some emotions to you and put my arm around you if it's possible. Now that takes more than a few minutes, right? But what's been going on here recently has been more of an assembly line situation where the whole fabric of the community of providers is being disrupted, and a third of them left. So they look to our union to help, you know, get a bargaining unit and make some of these go back to where it was, right? Because we want the old-fashioned medicine. So I'm here to support everyone here, Sue Katz and everyone on the who's stayed here at La Familia, and make it a better place. And we're going to learn a little bit more about, you know, how we can do that. I'm just here to, you know, give the support, give the union, and Rachel did a fantastic job in organizing it. She's a real community organizer. And, you know, it's a hackney word, it takes a village, but you're the village right here. So let's do something about this, what's going on, and turn it back into a correct track. You see the signs here, listen to the patients, patients before profit. I think that sums up what's been going on. My last thing before I turn it over is how to run a business. And I was up at Boeing with one of our units, and one of the guys up at Boeing was on the, have you ever been up to Boeing, the plant up in Everett, Washington? It's a ginormous place. It's got its own cloud weather system. It's the biggest building in the world. But as the jets go around this rectangle, the horseshoe they call it, the workers just follow the protocols, and Boeing got upset because the 777 took 28 days to construct a 777. And they didn't listen to anyone, and finally, when they were losing money, they said, oh, let's ask the workers. Well, the workers had so many great ideas that the amount of time it went down to 10 or 11 days. So everybody was happy in that situation. So this is what we want to explore here with you guys in La Familia, and make this a more efficient, happier place for you and the providers. Okay? Thank you.
I didn't get a mic, so I'm just going to stand up and project. Thank you, Dr. Bussey.
Sure.
My name's Allegra, and I've been asked to moderate this panel and then the community discussion. That's what we're here for today, to hear from some leaders in our community about La Familia and about our community healthcare, and then to hear from y'all about how you can be more involved, how you can get your voices more involved with shaping how the future of La Familia goes. Just a little about me. I am a Santa Fean. I am a community activist, I'm a lawyer, and I'm a teacher, and I'm a patient at La Familia. And so this stuff that you showed up here for today, and what we're going to hear about, really matters to me and my family, and the whole of the community matters to me. So what I'm going to do is, one more time, is there any, ¿hay alguien que necesita interpretación en español? Levanta la mano. ¿Sí?
So yo puedo.
Okay.
¿Quién es?
Gracias, Wendy.
¿Quién dónde está?
El señor acá. En la esquina. Okay, so I'm going to actually turn each of these panelists over to introduce themselves, because they can probably do it much better than I can. They're going to each speak for about 5 minutes, and then we'll probably do a question and then open it up to y'all to come give us some feedback and ask questions to the panelists and anyone else. All right? So first up, Alma Castro.
No me voy a parar. I'm going to stay sitting down. I'm sorry, Elena. Buenas tardes. Good evening. My name is Alma Castro. I'm also from Santa Fe. I also grew up in this community. I am not a patient of La Familia because I'm still figuring out what my healthcare system is going to look like. I don't really have a primary care doctor, so maybe I will become one.
Could you use the mic, please?
See, I don't know. Let me see if the mic will turn on. Can you work second? Or not working? Ready? Is it on now? Yeah, ¿me escuchan? Perfecto. Good, I'll start over. That was a little shaky. Buenas tardes, good evening. My name is Alma Castro. I am a Santafesina. I also grew up in this community. I am 35 years old and embarking on what it is to be a new kind of entrepreneur. I am looking to create a business that focuses on workers' want, democratic ownership. And I also happen to be running for city council, so I hope to change the way that our city sort of deals with our services and how we relate to workers in this city. We used to be a really worker-heavy, really progressive city, and I hope to get back to that. Sure, yeah. We can talk. Oh, I thought we were going to do introductions first.
Let's do introductions,
Sorry.
everyone, and then we'll come back to Alma.
Okay, I'm Sue Katz. I'm a physician at La Familia. I've been there 33 years.
I'm Sam Baca, recently retired from a 40-year career, mostly in the nonprofit here in Santa Fe, community activist, and also a patient of Familia.
So we've asked each panelist to speak for about 5 minutes to just introduce the issue and get us oriented. So Alma's first.
Claro que sí. So as you know, I've seen a little bit of change in our community, and La Familia is no exception. We've seen the number of providers reduced, the amount of time that we're spending with patients reduced, and the frustrations of our staff going up. They reached out to me as a former labor organizer to give ideas of what it might look like to unionize La Familia, and I'm happy to say that within the last month, it's happened. We have been able to get a union to represent La Familia and its providers, and we can only continue to build upon some of these efforts. Now, we need to look at the big picture as well. La Familia is the example of what is happening all over our community. According to the presentation of Alexandra Ladd, who is the Director of Affordable Housing, the average median income has increased 6% in 2023. Providers, nurses, patients can no longer afford to live in Santa Fe. That's one of the main issues that we need to be focusing on, including we're becoming quickly unaffordable for working families, and we need to really be focusing on middle-class families staying in their homes and being able to afford housing. We need good-paying jobs for the next generation. Folks who have young families don't necessarily see the opportunities to educate themselves and become providers and stay in their communities. It's shameful that our state government will not fund us without a third-party entity to oversee our finances, and we need to be able to come back together and bring our city together. I hope to be a bridge and work not only with city, but also with county entities that fund so many of these programs. I want to thank Dr. Busey and Rachel, the UAPD, and all of the brave staff that have been leading the fight for better patient care and for better working conditions for all La Familia staff. And I want to thank everybody who's here in the efforts to organize and to continue to help our healthcare providers at La Familia. Thank you so much.
I am passionate about community health and have dedicated my career to the belief that everyone has the right to excellent health care. I'm a believer in the community health movement and in family medicine, where the goal is to empower people to succeed in their lives by addressing not just medical needs, but emotional, financial, nutritional, and social needs. I feel incredibly fortunate to have been able to work at La Familia for so many years with exceptional colleagues, all striving to provide continuity of care in a comprehensive manner. This year has been challenging and difficult. I honestly thought La Familia was failing. I thought we were going to close our doors. Today, I have hope. I don't know if you guys, some of you guys have probably read that in the newspaper, the CEO is no longer with La Familia. That's as of Friday. And that, again, gives me hope that we can dig ourselves out of the problem that we're in. And I'm relieved that this forum has pivoted from can La Familia survive to hopefully how can it survive, how can we get more community support, how can we secure its future. I have some thoughts. We should apply our mission internally as well as externally by respecting and valuing individuals who work at La Familia to support their physical, emotional, and family lives. How can we care for others if we don't care for ourselves? We need to change the relationship of the board and the administration with the La Familia staff. They hired a PR firm, and their statements to the press of collaborative work and open communication have rung hollow. The providers need to have their clinical expertise included in all decisions that affect patient care. How do we move forward? First, I'd like to thank all of you for being here. I'd like to thank the church and the people working here to help. I'd like to thank the community. All of you have been supportive. You've written letters to the board. People have picketed. Thank you for caring, for being here. And just thank you. Second, I'd like to acknowledge that this has been a traumatic and stressful time for staff, and we need to work to create a respectful work environment. We need to strategize to support La Familia returning to a healthy institution. How do we change the relationship of the board with the staff? How do we build better communication, accountability, and responsiveness to staff and community concerns? Do we need a new board? Do we need new members? How do we make the board more representative? Those are questions I think we all need to discuss here. There is a patient advisory panel. And if the question is, are they being informed appropriately? Is it constituted appropriately? Do they have the power that they should have to help the board? The providers are now unionized, and that is a brand new happening just this week. I am hopeful that this will allow us to have voice again. We used to have voice. We stopped having voice. So I'm hopeful that now our voices will be heard. We as a provider group want to prioritize patient care, quality, and safety over productivity. We want to prioritize retaining and recruiting excellent providers. We want to have a say in programs and services offered. On the bleak financial front, now that providers will again have a voice, I'm hopeful that we can implement many of the ideas that we had for increased efficiency and productivity. We had many ideas, and they have not been listened to. We would like to hear more solutions and creative ideas from the board, the development team, and the management team. The community health center is not meant to be a for-profit entity, and you cannot balance the budget or survive by overworking providers. I speak for myself and the dedicated providers and employees. There's so many people who work together to keep La Familia running. We want to restore it to its important role in the community. And thank you all for being here.
So as I mentioned before, I'm native of Santa Fe and a lifelong resident of, and lived here all my life except for my higher education and for the first 3 years of my career, which I'll talk a little bit more about later. I came back to stay in Santa Fe in 1976, and one of the first things I did was start the Big Brothers Big Sisters program and serve as its first director for eight years. That's when I first became familiar with the work of La Familia. And I watched it in the early years of its development under the leadership of the then director and my friend, Dr. Arturo Gonzalez. And I continued on after that to 30 more years, mostly in community work and social services in our community. Because a lot of that work dealt with lower income and less privileged, less advantaged people in the community, my paths always seemed to cross with La Familia throughout those years. And all that time, I had the utmost respect for the dedication of La Familia staff and and very importantly, for the critical role that they played in our community, providing health care to the people in our community that in many cases most needed it and had the least resources to pay for it. And La Familia did an amazing job all those years of serving that need. I don't think it's an exaggeration to say that over the course of the last 50 years, La Familia has saved many lives in our community. And with just over the last year, I've gotten a chance to experience that dedication on the part of La Familia staff firsthand. I became a patient of La Familia a year ago. I'm on Medicare. I belong to a senior care HMO. My primary doctor retired last year, and so I had to find a new doc. And I found, when I was going through the list, I could see that most doctors were not accepting new patients. I was very pleased to see that La Familia docs, several of the La Familia docs, were accepting new patients. So I became a patient, and I could not be more impressed and more pleased with the care that I've gotten since I became a patient at La Familia. To give you an example of the dedication that I'm talking about, earlier this year I contracted COVID, and I was being treated for it by my primary care doc. And I was very surprised after hours one evening to get a call. I thought it was maybe from one of the assistants. It was actually my primary care doc calling to see how I was doing. So, but it was actually the first 3 years of my career where I learned the lessons that I think might be more applicable to what we're doing here today. In the early 70s, I was completing my work on my master's degree in social work at the University of Michigan. And in my very last semester, Richard Chavez, who was the brother of Cesar Chavez, came to our campus at U of M to recruit for the nationwide boycott of grapes and lettuce that was going on at the time. I was so captivated by Richard's presentation that I decided to go to work full-time for the UFW. And the next 2 years I spent on the Detroit boycott. And because of the success of the boycott, we were able to bring about the California Labor Relations Act, which gave farm workers for the first time the right to unionize. And I actually spent the last year out in the Salinas Valley doing field organizing for union elections and union contracts. So without a doubt, that going to work for the United Farm Workers was one of the wisest decisions that I ever made. I've always said those were my formative years. That was my real education. I learned more of the skills that I would use for the rest of my career in those 3 years than I ever did in school. And one of the most important lessons, and one that I think is really applicable to what we're doing here today, is the importance of community support for unionizing efforts. Cesar Chavez, in his wisdom, completely understood the importance of community support. Not only did he shine a light on the injustices that farm workers were experiencing throughout the country, but he also gave the public an opportunity to do something about it, to get involved, to support, in this case through the boycott. And because of the effectiveness of the boycott, farm workers were able to get union contracts for the first time in history. And so too with this effort here, community support is going to be one of the most important things that will support the unionizing efforts of the medical staff at La Familia. The board and the administration of La Familia are going to be more influenced by the fact that the community is behind the medical staff and supporting them than anything else. One more thing, I have been on the board of St. Elizabeth Shelter and Supportive Housing for the last 13 years. And one of the most important resources that we have to offer to our clients are the services of healthcare for the homeless, which is a program of La Familia. And I'm not sure if I don't see him here, but our executive director was going to be here and could talk more about the, and I think we have other members of the staff here that might be able to talk about our relationship with healthcare for the homeless during the public portion of the meeting. Thank you.
Okay, thank you. So we're here today to talk about how leadership of La Familia can start to incorporate community voice in the future of community health care in Santa Fe. And when we talk about the community, we're talking about providers, we're talking about patients, we're talking about staff, we're talking about anyone in Santa Fe who depends on the health of this community. So what I'm going to do is sort of ask that question generally to our panelists, but I want y'all to be thinking about your opinion about it, because really this is the voice we're here to hear today. So we're going to hear some of their ideas, and if you have questions for them, come up and ask them. If you have your own feedback, statements, ideas, we're going to open this up right after they share their thoughts. And Dr. Bussi, you too, right?
Yeah.
After everyone shares their thoughts, so we can hear y'all's thoughts, okay? So again, we're just, how can La Familia leadership start to better listen to the voices of people in our community who depend on community healthcare?
Okay, that's a huge question. Yeah, of course. So I think it's really important that we build on the work that's already been done. I think as we've heard, there's been lots of conversation already and lots of sort of input, and that's a process that's happening all over, not just in healthcare, but we have community input. We've been doing research for, at this point, generations, right? It's 1973 is when La Familia started operating. And so we have a lot of knowledge and information, but we're not necessarily putting that into practice. So for me, community input is not just about having these forums. Yes, this is important, but also talking to your provider and having more time, as we said, with your individual provider to be able to build a plan that is right for you. And the other thing I want to say is that La Familia is a service that we cannot do without. As many of us have already heard, this is one of the only healthcare options for folks who don't have the means. And if we close down La Familia or we reduce the amount of patients we can see here, the only alternative is going to be emergency rooms. People are going to get much sicker and they're not going to be able to get the healthcare they need in our communities. So being able to see more patients is going to be a big priority.
Yeah. I'd like to echo what you just said. You know, I mentioned that it used to be just doctor-patients, right? Back in the day, and since managed care came in, or administrations, and the graph shows a 3,300% increase in administrators over 40 years and a 150% increase in providers. So this is like ox pulling a cart, and they're more and more jumping on. That's why the burnout happens. To your question, Allegra, a couple of things I was thinking, and to go out and amplifying what you just said, Alma. You go into a room, let's say you have diabetes or something. There's expensive, you know, I don't know what the insulin costs here, you know what's going on in Medicare and paying for insulin. But if you have a specific problem, medicine is part science, it's part art, and unfortunately it's part politics. So it would be good to have these forums. I mentioned, like Sam is now a patient of La Familia, your issues, whatever they may be, speak to them like, it's hard for me to get the medicine, whether it's insulin or some exotic anti-inflammatory or whatever you want. Bring it up, because the administrators at La Familia have their own thoughts on what they're going to pay for these different medications, what they can pay. But like I said, if you coalesce with the providers, you have a lobby, right? And lobbying makes the world, lobbying means just influencing, right? So you get a petition. All the things that we've done at our union, UAPD, have come through the collective forces of the patients and the doctors. And you have to have your permission. Say, Joe Smith said he wants, more of this on the formulary. But, where privacy is number one. If you want to do this, get about 100 people together or 50 people before you state what you want. There's strength in numbers. But if you get a petition, 50, 100, or 200 people that want a certain medication or protocol or some service that La Familia can do better, that will help the provider's voice. Now, the union has many FQHCs. We're servicing FQ. I just finished a negotiation in Berkeley with Lifelong, which is a bigger FQHC, but the number one issue is just like yours, is the voice. So we have, I can bring this up, we have a healthcare transformation provider that is paid half by the union and half by the administrator. So it's sort of a hybrid. He speaks with, with the side of the administration in his mind and the side of the providers in their mind. So it doesn't have to be antagonistic, right? It's not like the old days. Unions are bad things. But there's synergy involved. So you got to be creative, and you have to look at the administrators as partners. Okay, I think everybody would agree to that. We're not here with our fist out. We're here with our brains and an olive branch. If necessary, we'll get you. This is great what you guys say. There's almost 100 people here. If you do this with specific needs that you have in your healthcare delivery, I don't know if CPAPs are cheap here, but sleep apnea, diabetes, whatever it is, find a need that is deficient and work with the providers to make a lobby and to push for it in the most efficient way. And the union will support in any way we can to do these things. So that's my 2 cents on how you can help. You help with, supporting these guys and being a lobby to them and getting, if you're afraid to do it with 2 or 3, I don't blame you, You don't want to be a troublemaker. But if you have a group of you that have a specific need, then let's get a petition going on, and they will be very impressed, believe me, when they see the patients, not only the providers, want this. So that's one idea.
So I'm curious to hear your guys' ideas, because I think a lot of you have vested interest. A lot of you have put time and energy into thinking about this. So I'm curious. I think we as the staff at La Familia are going to be working our little bottoms off, trying to keep things running over the next few months. And Gary Giblin, who's here, thank you, is as of 2 days ago, our acting medical director. So we have a medical director. We have the union to help us, and we need community support.
The only thing I had to add, as I mentioned in my presentation, obviously community support is the critical thing, and as was said earlier too, the administration doesn't have to be the enemy. In fact, one of the goals of all of us should be the survival and the financial stability of La Familia, because that's necessary for it to continue to go. So in that the community support has different avenues. We certainly support the role of the doctors and the medical staff to make the medical decisions that have made La Familia the great organization providing such effective health care as it has in the past. So that's their role. Their role is to make those medical decisions. The role of the board and the administration is to find the resources to keep the organization alive. And as those of us in the community that love La Familia and that support La Familia, support the rights of the medical staff to run the medical operations of the organization, but we also should support and try to identify whatever resources it'll take to have La Familia be financially stable and solid.
Time for community questions?
Yeah, so we actually have a mic set up so everyone can hear you. Yeah, if you'd like to come up and make a comment or ask a question to the audience.
Maybe we could turn it the other way.
You.
Should work.
There you go.
Madeline Pryor. I've been a patient at La Familia for about 3 years after I hunted and hunted for primary health care, primary provider in Santa Fe, and nobody was taking patients. And I've received the best medical care ever at La Familia. Now, my wonderful family medicine resident who was going to return left, so I don't have a primary provider at La Familia or anywhere anymore. But in the 3 years I was there, I had excellent medical care, and I was pulling my hair out at billing because I have Medicare Advantage, United Healthcare. A lot of people my age have that, and it kept getting denied, and I have spent hours on the phone with United Healthcare and trying to track down La Familia billing. So that might be a resource that could use some administrative support at the clinic. And
I'm gonna ask you a question. Do you have any ideas about how that input could get to administrators?
how what?
How that input can get to administrators, because that's part of what we're here to talk about today, is how do we get that extremely important complaint to the ears of people who need to hear that and understand what patients' experience are?
Well, I don't know how to get to administration. My background's nursing, and it's gotten more and more difficult, not just at La Familia, but everywhere. I'm curious about who is the board and how do they get selected, and are their meetings open to the public ever? Or, their decisions and how they make them, do we have any access to that?
Wendy, can you come up and talk? As far as I know, the board is all volunteer.
Correct.
They are self-selected, and then they select each other. They are supposed to be representative of the community and the patients, but the way they've gotten around that is that when they hire somebody new, they say, pick a provider. So that there needs to be at least 50% of the board as patients. They're supposed to provide translation for Spanish-speaking patients. We are supposed to have someone who is unhoused, and usually they find somebody who was previously unhoused. At least that's my understanding. But most of the time, I'm not sure we have enough representation of those groups who I think should be part of the board and are supposed to be a part of the board by statute.
Do we have any board people here?
Board members in the room?
It's an incredibly hard job, actually. People volunteer hours of time.
Anyone can volunteer.
I think you have to be selected.
You have to be elected by the other members
Yeah, you
of
have
the board.
to be.
Just
Well,
depending on the bylaws, but most nonprofits, that's the way it works.
Yeah, then maybe there's some answers.
Welcome.
Thank you.
Oh,
Yes.
Thank you.
Thank you.
Part of the confusion is that there are two different boards at La Familia. One of them is more like the business board of directors. And that's the one which I believe is selected with specific backgrounds to be in more of an advisory capacity, but they're supposed to be the liaison between providers and between the patients. That's what I was told. I'm a member of the Patient Advisory Board.
So there's a patient advisory
Right.
board and a board of directors.
And we meet every
Different
other
than the governing
week,
board.
and the Patient Advisory Board is volunteer, but we're supposed to be representative of a demographic of the patient population at La Familia, and I would say it's pretty well, a good age range, good demographics reflection of Santa Fe. But there's, over the last, when did the new CEO start? Because
February.
to me,
Yeah, 5 months.
my perspective is there was a material change that occurred at La Familia within the board
and the attitude overall about the purpose of La Familia when Jay Jolly retired and the new CEO came in. You could feel it. You could feel it in the patient advisory meetings. You could feel it in the communication that was sent out from La Familia, from the board. It was more about business and marketing and PR and much less about patient care and the community of La Familia. And sitting in patient advisory board meetings, you could also tell there became a disconnect between the providers, the board of directors, and the patient advisory board. The board of directors stopped talking to anybody but themselves, and I think that was driven by the CEO. And the patient advisory board, even though we kept asking questions, what is going on here? We can feel it. We know things are changing. There's a tension that we can feel. Providers are leaving, and I had never experienced that before. And the message was, you could read it, the message we were given in the agendas of our meetings was written by a PR firm. I mean, it was just like boilerplate, where you read it and it's like, who wrote this? They've never been to La Familia, they don't know the way the operation works here. So there has been a tremendous amount of frustration internally, not just with the providers, but with the patient advisory board. And all I can tell you, anybody who has the kind of input that was just shared, just contact La Familia and tell them you have a message you need to be conveyed to the patient advisory board. And then one of your representatives will make sure somebody hears it. Okay? There you go.
Thank you.
Wendy.
I have a question about how does one get on the patient advisory board?
You
And also,
volunteer.
I'm sorry, one other question. Is there any Spanish-speaking or undocumented immigrants on the patient advisory board? Because that's about 30 or 40% historically of our patient population. Only Spanish-speaking, not speaking English very well. Do you have any representatives of that large?
Half of the patient advisory board, I've been a member of that for I think the last 3 years. Half of the membership has been Spanish speaking. The first year, which was an overlap for me with somebody who then left, was from the unsheltered population.
So you have translation at like people who don't speak English?
Yeah, translation is always an option there at the meeting. Yes,
Okay.
absolutely.
So how, is there a way, like you say volunteer, but can you tell these folks who might want to volunteer how they would send that to, or
Sure.
how
I mean,
they would
really, anytime you're at La Familia, they have signs up there now, at least the last time I was there, saying if you're interested in serving on the patient advisory board, just tell somebody at the front desk or whatever, and then they will be in touch with you. That's exactly what I did. I just started feeling guilty that I was always at La Familia and then I needed to do something. So I volunteered, and it's really actually been very informative, and it's been an enjoyable experience until the last few months, I would say. Okay?
My name is Christine, and I'm actually the board coordinator at La Familia, and I have been for 10 years. Maybe tomorrow I won't be. But the Patient Advisory Board was formed a few years ago after a site visit because we had to prove that we had patient representation and input towards the board. And the patients were originally chosen. We just asked providers and we asked administrators, did they know patients? Because, you know, certain patients do float to the top and come to admin and are more active than others, and that's kind of how it started. But they didn't meet through COVID. They don't have any power. They don't have any voting. They just advise and tell the board their experience from the patient side. So if you want to join, yes, please, I'm the one that tells the board that somebody has interest. As far as the board of directors go, that's a whole nother thing. It's a fight that has been being fought for ever since I've been there, and also with our previous medical director on telling the board that they're too white, too privileged, and don't represent the patients that we represent, which is what is actually like the law if we're supposed to be getting federal funds, that we're supposed to represent the patient population. So that's the board. That's and so they do kind of select themselves again, like, oh, we need a lawyer, and we need a doctor, and we need a finance person, and we need a this, and it's too hard to translate the financial documents, and you know, a community person wouldn't understand how complicated this is, as if our patients don't serve on church boards and soccer clubs and aren't on the PTA and have kids and whatever. Anyway, so that kind of tells you how the board works, and we do need, and we know it's hard, it's a lot of work, it's not easy. They're not, you know, it's a large organization, a lot of money, and there's lots of federal overlords telling us that we have to do things in certain ways. So it's not an easy job to serve on the board, but it's an important job, and we need you all to please apply to join the board, or, you know, please, we need more of you on the board than who we have. As far as the way forward, as a staff member, I'm going to say that we're going to need some acknowledgement about what went down, that we can't just gloss over how people were harmed, and not just the staff, but the patients. Thousands and thousands of patients were rescheduled. Dozen providers have left, and we've had to try to accommodate those patients. Our staff at the front and on the phones having to deal with all of these sudden changes. There has been unnecessary harm, and it needs to be acknowledged as part of moving on. But we all stuck around, and we stuck through it because we love La Familia, and we want to make sure La Familia stays. So please, thank you. Join the board.
Can I ask you a question? A couple of questions.
We should just make a line.
Yeah. First, thank you for, you know, being on that ship where all these things were going wrong, and your dedication. My questions are mechanical questions. Who is the board technically accountable to, and are there free and open elections other than you're it, and you're it? And how can we implement that?
So the board's accountable to HRSA, which is under Department of Health, because that's who we get our federal funds from. And HRSA also decides our policies, and they come in and do site visits every couple years and say if our policies and our bylaws and our whatever are in compliance with what they require. We also are accredited by the Joint Commission, and they have a set of rules and regulations, but they're not, we're not required. It's just an extra bonus, and we get paid extra because we have a certification of some kind. The elections, the meetings are not open to the public, and the elections are held every year, but it's within the board. They nominate and elect their members, and they nominate and elect their board. Their officers, I should say.
That's got to stop.
And the bylaws do require that we have a homeless or a homeless advocate on the board. So sometimes they have been either people that have worked with the homeless or have been formerly homeless and are now stable enough to be able to serve on the board. And we do, if something like you don't have a computer or you don't have Wi-Fi is why you don't join, we can get you past that. If something is like, I can't get there because I don't have a car, we can take care of that. If that's your barrier to joining the board, we have resources to help you get over those barriers, so don't let those things stop you. So, yeah, that's the makeup of the board.
Thank you.
Okay.
Thank you, Christine.
That was actually very helpful. That might have obviated some of my questions. My name is Megan Van Winkle. I'm a mostly retired family doc here. I do not work for La Familia. I never have. I do not get my care at La Familia. I never have, but I've certainly been following what's been going on in the papers, and I have an unfocused amount of energy. What would help me most, I don't know how many people feel the way I do, is I have some time, I have some energy, I understand some of the conflicts. A lot of it comes down to bottom line and money, and the other side, which is not represented here, is going to have some pretty compelling arguments. I would like to know how to focus my energy. It sounds like maybe it's the board, but I don't know. If we could be given names, numbers, a format for what to write or how to get together, I think that would optimize the time that we do have. So I'll take your responses. Thank you.
Thanks, Megan.
There'll be a follow-up email from the emails we got.
Good afternoon, buenas tardes. My name is Lisa Kakari Stone. I live in Santa Fe on the south side. I've been a patient of La Familia for 20 plus years. My provider is Dr. Sue Katz. I feel very fortunate to be part of La Familia, but I want to mention something that I think as a patient, but as a health policy, health equity leader in New Mexico and in public health. I staff the Community Health Center 40th Anniversary Movement Act for Senator Kennedy and for Dr. Jack Geiger and many others. We need to know and come together as a community and understand the legacy of FQHCs, federally qualified health centers, and community health centers. Up in Tierra Maria, the uprising up there, the land grant, and people coming back for their land, people standing up for their rights, or for racial justice, community inclusion. This is what health centers are about. The first health centers in Mississippi were implemented because slaves, one of my mentors, Dr. Elsie Dorsey, was a daughter, and she was a slave, and the daughter of slaves. The Mount Bayou, Mississippi Community Health Center was developing educational advancement and economic opportunity for their community. Community health centers were birthed out of the Economic Opportunity Act of 1964. It is important that our providers be unionized because it provides economic opportunity and incentive. Providers go into health centers not because they're advancing their careers and big salaries, it's because they have a love and a heart for community health. So we need to protect them. I want to also mention the only piece of federal legislation that requires civic engagement in health policy and congressional law is through the FQHC requirement by the federal government that there be 51% participation of persons from the community that are patients, not as advisory, but on boards. And so we're talking about governance. 31.5 million people are served by health centers today with over 15,000 sites in the nation. La Familia is a legacy in Santa Fe, in northern New Mexico. We cannot let La Familia close their doors. And so I'm thinking about governments, a community accountability committee, an audit. The National Association of Community Health Centers has a technical assistance. Many of my colleagues have worked there to help regarding governance and how they can come in and provide training. We need our congressional members here because they oversee the implementation of health centers through HRSA and the U.S. Department of Health and Human Services. Many people who've worked at HRSA are from Nuevo Mexico. We stand strong today. We can't let them close their doors. We need our state legislators here. We need Governor Michelle Lujan Grisham here because access to health care is critical. This serves so many, and it's the only safety net in the United States that will serve all people regardless of immigration status and language spoken, LGBTQ, and anyone. So it's the only community health center that serves all, and we all know that, but I wanted to provide that history because this is about a legacy of racial justice and human rights and social inclusion dating back to the Johnson administration. And I think we all need to get rowdy, bring 5 times as many people here, and I want to leave today with a plan and how we're going to support our providers and look at a different form of governance. Thank you.
My name is George Campbell. I'm the chair of the governing board at Santa Fe Community College. And I'd like to offer a institutional view of the importance of La Familia. There are roughly 6,000 students at community college, many of whom do not have any kind of health insurance. Therefore, many of them utilize the services of the providers at La Familia. And that's critical for their whole lives as students, that they have some kind of health care services. Unfortunately, the college we don't provide that yet, maybe someday, but not yet. So that's a very critical part for a large percentage of our students. Secondly, and equally important, the community college has about a dozen different medical training programs ranging from nursing and dentistry to phlebotomy and a number of programs in between. All of those programs require some kind of clinical experience. Well, where do you get clinical experience? La Familia. So here we are trying to train medical professionals in this community for the future. We need La Familia as some of the sites for our students. I don't think we can overstate the importance of La Familia in the community. And indeed, my question, and you've spoken about it already, is how can we help, both as an institution, as individuals, to promote the continued existence and very improved basis of communication between the board and the providers. I'm just, as a board member at community college, I was elected to my position. I'm just astounded to hear that there's a board that is formed in that way and operates in that way. At the community college, we are bound to notice all of our meetings. They're all taped, and you all can see them at any time you wish to, or you can come to the meeting itself. And another community board that doesn't do that, I am astounded. Thank you very much.
Hi, I'm Christy Neslin, and I don't get my medical from La Familia, but I have been a patient at the dental clinic for over 20 years, and I've seen it go downhill. And I was just there last week, and I was shocked. I thought this place is going to close, or that's the worst case scenario. The best case is my dentist will probably leave. So I know what you're all talking about. But I came to this meeting because it talked about community health care. And so I wanted to kind of open it up to what's happening in the entire community. And that's the other institutions. Now, I don't know what's going on with Presbyterian because I live on this side of town. But Crisis St. Victims has just instituted a policy of hospital-based billing, which means that if you go to any of their clinics, not just the ones on site, but anywhere, you have to pay the hospital outpatient fee. So I went to one of the clinics and was told, well, we'd like to do a series of 12 treatments. Well, in my case, and it seems to, one of the insurance plans that seems to have the most, be the most susceptible to this is Medicare Advantage plans. So in my particular Medicare Advantage plan, I would have to pay $225 for every visit. 225 times 12, that's not going to happen. So basically at this point, I guess I can go for preventive care and that sort of thing, but if I go for preventive care and they find something, I can't do anything about it. I cannot afford health care anymore at all. And So I would like to see liaisons between the medical providers and the hospitals. And I'm thinking particularly of how when Obamacare was being debated, how the nurses unions in California really came out and were supporting Obamacare. I'd like to see things like that. And at the very least, providers, when you refer somebody to a crisis victims clinic, I think you owe it to the patient to say, and you will because they've got the best specialists. I think you owe it to the patients to say, look, you really, really, really need to check your insurance and find out what this visit is actually going to cost, because I think people are going to be really in for rude surprises. And also preferably get billing involved so that they can find out, because it took me 4 months to find out. I was calling the insurance, I was calling Crisis St. Victims, I was calling everybody, couldn't get a straight answer. Finally, I went to the Attorney General one time and got blown off. Then I went to the governor's constituent services and they bumped me back to the Attorney General. So they had me write up a statement and send it to Crisis St. Victims. Then I got this reply that was a masterpiece of obfuscation. And basically, they were saying, oh, good news, it's not going to cost you $1,000 a visit, as the woman at the doctor's office told you. It's only going to cost $225. You know, so that's where I'm at, just not going to get the treatment. So I would really like to see community organizations and clinics working together, first of all, to get rid of this policy, but also to help patients realize what the true costs are going to be. Thank you.
Hello, everybody. My name is Shannon Milligan, and I am a supportive housing navigator through St. Elizabeth Santa Fe Suites. I don't have any suggestion of a solution, but I do just want to say what this service has meant to the people that I serve. We have a clinic that operates from La Familia there 1 day a week. And it means that people who have some mental disability and are afraid to go to the hospitals can go and get treatment. I have seen so many people say, I will never go to the hospital. That's where people go to die, or they're going to lock me up. That go because they have a trust with y'all, and they go in there, get their medical care. People who are unhoused, who never knew about it, can come up and say, oh, you guys have a clinic? And we say, yeah, and they say, come on in. So much wound care. But not only do they give them the medical care, they give them the dignity that they deserve of receiving a free and appropriate health care. And if y'all were to close your doors, I guarantee you that we would see many of the population that we serve, that I serve, would be without health care. We would see an increase of deaths, an increase of COVID. You can keep going on and on. And so again, I just want to say how important this service is, this community healthcare is, and how much it is meant to our agency and to my clients and to the people that we serve. Thank you so much.
Hi. My name's Scott Rain. I'm a patient of La Familia. I relocated to New Mexico from Ohio about 1.5 years ago, and so I had to find a new provider. And I felt fortunate to kind of my options, select La Familia. I also have experience working for nonprofits in different roles. And one of the things that I think one of the panel members mentioned is that a board of directors has to comply with the
HRSA?
Pardon?
HRSA?
The bylaws, thank you. The bylaws of the organization, which states how board members are elected, how meetings are conducted, et cetera. It's not necessarily unusual that the meetings aren't open, but there is requirements of how they are selected, how they need to conduct themselves, the mission of the organization, and what might be the case, and I'm not familiar with all the facts, is that maybe there's been a little bit of loss of focus towards the mission, complete mission, meaning serving the community, how they serve the community, all those types of nature. One of the things I do have experience with, any organization, nonprofit or otherwise, that receives federal or state funding also has to comply with certain things. And just throwing out some suggestions, because I know that's one of the objectives, I believe, is if the board is maybe losing focus of compliance with the bylaws, compliance with funding given from federal or state funding, whether it's a community action group or whether it's a patient advocacy group, one of the things that one of those groups, or maybe together, can do is help remind them of the obligation to do that. And that could be something if there's turmoil within the board of directors. It sounds like there maybe will be some refocus. We'll have to wait and see how that turns out. But that's one thought. Another thought is, obviously, if I'm a patient and I have a concern, usually I'm going to go to my provider first. That may or may not help resolve it, or the provider might be hitting brick walls within the organization as they try to advocate for the patient. But then, again, whether it's a patient advocacy group that basically reports to the board and provides information, it sounds like in some cases that group has been stonewalled a little bit of late. And again, whether it's that group or community organization of patients going to the board and say, hey, wait a minute, you've got this group in place, it's in the bylaws, or it's something there where there were decisions made, and here's the role of that, and you're not listening to them. Again, there's another opportunity to kind of remind them that they're losing focus of the mission, they're losing focus of the purpose of the group. You have community action going on if maybe that patient advocacy group is not, they're hitting brick walls and it's not being effective, but a community organization of patients or healthcare advocates, again, going to that board of directors saying, you're missing some stuff, you're not living up to your obligation. So those are just some ideas that have come to mind as I was listening to everybody speak. There was a lot of good ideas thrown out.
Thank you.
Thank you.
I'm going to try not to talk too loud into this because I have a very loud voice. So my name is Carla Teal. I'm the program manager for St. Elizabeth's Casa Familia Shelter here in Santa Fe. We're the shelter for homeless women and families here. I've been with Casa Familia for over 7 years now, so I couldn't count how many patients and how many clients that we have sent over to Healthcare for the Homeless. As a case manager, we would do intakes with clients. They haven't seen a doctor for, who knows how long. They need medications filled, and we would send them to Healthcare for the Homeless. They would get the services they need. They would get emergency medications filled. They would be listened to. They would be heard. They would be seen. So to hear that this is happening, I was really upset. That's why I'm here today. Whatever I could do as a representative for Casa Familia Shelter and the staff, please let me know. If you need representation to come to meetings or to speak to the board, please let us know. Again, the services that you all help with our clients is, I could just go on and on. Healthcare for the Homeless has come to the shelter and done testing for the clients. They've given us supplies. They've just always really been there for us. And so I would like to do whatever I can to support you guys in the future. Thank you.
Good afternoon. My name is Dylan Schwagel. I'm a city navigator, outreach specialist with the LifeLink here in town. I also work with the homeless population. Well, I just want to say first that seeing all of this and listening to some of the people talk here has been very inspiring to watch. And I also just want to add too that this sort of tension, or there feels like there's this squeeze coming down on so many of the healthcare and social services system here in this community, and that's being felt by me and a lot of my colleagues around town. I don't know about you guys, but this, and I see some of you here from Santa Fe Suites and Pete's Place, Casa Familia. I don't know about you guys, but when I talk to some of our colleagues, it definitely feels like this is an all-time low for us in terms of morale and in terms of the functionality of the system. And it's eye-opening to see how that is impacting everything just across the board. And what happens at La Familia is going to have an effect on our work as well, because it's not just going to impact the providers and it's not just going to impact the patients. If La Familia goes down, that impacts healthcare for the homeless. Healthcare for the homeless is essential to the work that we do, and they are an important component of social services around town. And if they're gone, our clients, the people on the street, are worse off. And all of you know that we are oftentimes along for the ride with our clients. So when they're not doing well, we're not doing well. And again, it's just inspiring to see that there's a real effort to fight back against this trend that feels so insurmountable. And I also just want to say, because we are feeling the same kind of tension, the same kind of squeeze in social services, that I've been having a lot of conversations with some of my colleagues around town. I'm sorry, Santa Fe Suites crew, I've been wanting to come by and chat with you guys, but I've been a little busy lately. But I've seen very clearly in the conversations that I've had that there's a real sentiment that we need to be doing more of what the union is doing for La Familia. That it is getting to the point now where we ourselves in our field need to also start organizing, also start uniting, and kind of break down the silos between our different programs so that we can really push forward the changes that we know that we need to be done, and we know how to do them because we've been on the ground and we've seen what's been happening, just like the providers have been seeing at La Familia. So I'm really happy to be here and see all of this. I'm really looking forward to kind of learning from watching this organizing effort here, and I hope that me and my colleagues, as we continue to have those conversations about organizing ourselves, that we can provide substantial support to this ongoing struggle in the future, because that's what we all need to do. Is we all need to unite as a community to stop these forces that are coming down and putting a real squeeze on all of us. So yeah, thank you so much for your work. Yeah. And for those of you that know me, speaking of organizing in social services, let's talk after this meeting.
Hello. I will tiptoe. My name is Sue Carr, and I have been a community member in Santa Fe for now starting on 10 years. I have also been a patient I am now a patient with La Familia, and I have All right. But I am a patient with La Familia, and I have also been an employee with Pete's Place, with the Interfaith Community Shelter at Pete's Place. I've been there. I'm going to start year number 10. And so most of the people that I know in the city of Santa Fe are currently experiencing homelessness. And I came to the shelter and I started working there as a, quote, part-time job. But I noticed that there was this organization called Healthcare for the Homeless that came twice a week. They would come on Tuesdays and on Fridays and provide care for anybody who requested it. No questions, no comments. It wasn't, let me see your ID, let me see your, insurance, prove that you have insurance, and this kind of insurance. It was just everyone across the board. And it was stunning to me. And so when I was looking for somebody to be my care provider, that became a no-brainer. And I just wanted to say that they are so crucial for our population, for those folks, our neighbors who are currently experiencing homelessness. And our population, that population is increasing in behavioral health issues. They are increasing, they are becoming older, they are aging. There are so many things that are continuing to complicate the situation of homelessness. We need the care providers. We need them. They know it. We know, we all know it out in the community. And for those of you who don't know yet, yes, we need this. We need this. It is crucial. And I want to thank them for their service, for their work, for the years of work way before my time. And I hope that it continues. And I personally, as a member of the community, I will do, if you need something from me, give me a call. Thank you.
Hi, my name's Paula Devitt. La Familia became My Familia in 1984. My husband got stationed here with the Health Corps, and we packed the car and moved the kids and 2 cats. No, anyhow, and came to work at La Familia. And my family has been getting care at La Familia, and my parents currently lost their provider as one of the providers that left, but we've been given excellent care. And as a mother of a family medicine physician, as the wife of a retired family medicine physician, providers across our country in primary care have become disempowered and are fighting this same issue so that they can continue to provide quality of care for everybody. And La Familia not only provided medical care, but behavioral health, pharmacy support, food support in the community for all of these years. And I think we have to fight for it. It gives a very unique care and a very unique mission. And the providers that have been working at La Familia came to work at La Familia. I say they're missionaries. They came not because of pay, not because of easy schedules, some of the innuendos in the paper, but worked very hard in extra hours to provide all of us with excellent care. So, and the staff at La Familia, all the way, the front desk, phlebotomy, everybody, are very much dedicated to the mission of the clinic. And I love every single one of them for their dedication to us and community. And so, as a person that refers patients that don't have a care home to La Familia, because I believe they give the best care, and it's not just because of social income
and uninsured, but actually because of the quality of care and the disease management and chronic disease. So a lot of the patients are very sick and come in without having previously had health care for years and have sometimes 32 diagnoses to go over. It's not possible to do it in 15 minutes. So the providers aren't really like being crybabies. No, anyhow. They're trying to advocate for being able to give us the very, very best care. And as patients, to navigate the healthcare system right now, every single day I get calls for help on how to get through or how to find their insulin on a weekend, when now we have issues like Walgreens running out of fast-acting insulin. We have care in our healthcare system is broken in our country, and we do need to change it. And I think that as a community, we change it from the grassroots, and we provide support to the people that are doing a really good job at it, and don't let them leave. We're losing too many primary cares, and we don't have people to get patients in with anywhere in our community, and it's scary. Thank you.
I apologize. I have to catch a plane, and I want to make some remarks before I leave. Everybody here, you made some really good remarks about the HRSA, about the accountability of the board. There are other gentlemen making remarks about, looking at the bylaws and doing all the legal stuff, right? But you know what? The union recognizes that healthcare is political now. It's not just scientific or artistic. That's the basis of it. These guys are artists. The primary care, I've been a family practice doctor for 37 years myself. Sometimes you have to extrapolate what you see with the symptoms, take a educated guess on what's going on. It's not easy to do that. So there's a lot of stresses on these providers. I understand why a lot of them left. What can you do? What am I trying to say here? Here's what I'm trying to say. Okay, it's a triangle, okay? So the basis of it all was the patient-doctor relationship. But now other people have gotten into this game, $4 trillion worth of it. We need you guys to help us change in various ways. So I was writing some notes here. Not having an open meeting. We have the Brown Act in California, which requires, open meetings. If we don't have it now in New Mexico, Alma, let's get some people in here to create one, to create openness in the board. Secondly, I don't know if we have a sign-up sheet, but after today's presentation, I hope some of you would be interested in putting your voices on this board, because you got common sense here, and that's what we need. We don't need business. Well, we do need some business sense, but we need the input of both of the forgotten patients and the forgotten providers who have a wealth of knowledge. So that's what else I want to say. You could earmark funds, like the lady was saying about the insulin, like I said before, and get some sort of legislation or budget changes in New Mexico for special needs, such as you probably have grants for undocumented. Let's have it for other areas that are in need. Billing people. How about a point person? That's what we do in California. It's the hardest thing to do on, who writes the bills. There's a little old person somewhere in there that you don't know is hiding in a cubicle. That's one of our union objectives, is to find out what the sensitive point on billing is, or to have a billing town hall. And underlying all of this is noise. Well, that's a crude way to say it. Interest, support, sympathy, but I say in the union world, noise. And that means getting media. We're prepared to do that. We just got some money for our psychiatrists up in the prison system in California because we put radio ads out. And if you don't listen to you guys, we'll have to elevate it, and we're prepared to do so in our union. So we're here to do whatever nook, cranny, or whatever that word is, whatever means we can to get your voices in there and to create political change and legislative support for you. So with that, I say thank you. Okay.
Thank you.
I think we're reached 4:30, but I think it's important to ask one more question, and I think this is open to anyone in the audience or anyone who's left on our panel. I see some consensus listening to all the comments that there are problems in the system and that we can't afford to have this care slip in this community. Yeah?
Well, I've been a member on a private board, and we didn't have to comply with the Open Meetings Act. It was through a meeting.
Exactly.
But I believe that board needs to comply with the Open Meetings Act.
Yeah.
And it'd be good to get a copy of their bylaws.
You're beating me to it. And I think one of the resounding and actionable things that I'm hearing here is that there is a lack of transparency, there's a lack of the community's understanding of our rights to participate and make decisions, and there's a dire need of education within the community that cares about this clinic to understand how it works, who's in charge, who's accountable, and how decisions actually get made. So my question is for this audience, and what is the next step for you? I just heard, let's get a copy of those bylaws.
And we might want to invite Rachel, but I know there was a sign-in sheet, and so there will be follow-up to this meeting for anyone who signed up at the door. But part of that could be getting the bylaws out. Sorry, I don't see Rachel right now.
Yeah, so one thing I heard that is an actual next step to start dealing with the frustration that I hear is, what are the bylaws of La Familia? What are the rules surrounding the boards? That stuff should be transparent. And this is now me not moderating, this is me editorializing. People telling you, oh yeah, you should know that, is not them actively asking you to participate. There are ways that we can engage people, and we don't blame them if they are not engaged. We remove the barriers to their engagement. Yes. And I think that's a totally reasonable thing for us to request. I have been a patient there for 10 years. I don't know who any of the board members are. I don't think that's my fault. I think that's a lack of transparency. Okay, so that's me.
There's
back
somebody
to be
that
a
wants
moderator.
to speak over here.
If you'd like to come up and suggest a next step, please come forward. And I'm gonna, is there an end to this meeting?
No, well, so the organizers, I think, were gonna give us next steps.
Okay, the organizer?
Rachel, so I'm not, I think she might be in the entryway.
Yeah.
But I think part of it is going to be maybe at the next board meeting. So we tried to meet at the board meeting that recently passed, and it got moved online. So we may or may not have access to those board meetings even in the physical sense.
Hello, my name is Lori Pearson Kramer. I've been a Santa Fe resident for 30 years. I've been in healthcare for 25. I'm a certified nurse midwife. I currently work at Mountain Spirit Integrative Medicine, and I've been there for about 2.5 years, and the reason I moved over there is because I used to work at what was formerly Women's Health Services, bought by Southwest Care Center. The same exact thing happened at Southwest Care Center about 2.5 years ago. So I'm here in solidarity to the providers that left because I left for that very same reason. And I am not sure exactly what the solution is, but I love the fact, as a daughter of a union member, that La Familia providers are unionizing, and I am suggesting that all providers in Santa Fe unionize. I would love to get back into community health care. I really would. I am at a private place that I'm making money for a single guy. Doesn't make me happy. I want to get back to providing people who have Medicare. I had so many Medicare patients and I had to leave them all because the administrative nightmare of dealing with Medicare was too much at the place that I currently am at now. So there's a lot of problems in healthcare, we all know that, but as providers, we just really need to stand up together, all of us. And just, that's the only way we're gonna make a difference. Thank you.
Thank you. Next. Just hold it off.
Oh, yeah.
All right.
My name is Diane Montoya, and I am a patient from La Familia. I am a lifelong Santa Fe resident. I've been to many doctors. I got to La Familia kind of by accident because my endocrinologist gave up his practice and decided he wanted to go help over there. So I moved over there. That was the best thing that ever happened to me. I love my Dr. Sue Katz. I tell everybody this. I always have. And I got my two sisters to switch from their private practices to La Familia. And believe it was last week or the week before, my sister found out that her physician was gone. She didn't know why. She was heartbroken. And of course, you have to be rescheduled with somebody else. I don't know when that's going to happen. But I would never leave. I sing the praises of that place because of how professional everybody is, starting from Dr. Sue Katz, everybody. She's just amazing. I can't believe anybody's being treated the way they are. You know, I grew up when you had respect for doctors, and you know, so that's where I'm coming from. Plus, I worked with kids all my life. 30 years I retired. My husband worked for the fire department 30 years, and you know, we were public servants too. And I just hate to see the kids and the young parents, you know, not go to the doctor now. Because I sit there and I see them and I play with the kids, and you know. So I guess my question is this: how many people that actually go to La Familia know what's going on? And how do we let them know? You know, how are they going to help out? I found out clearly by accident, you know. My sister was like in shock, and I'm the one that told her to move. It was such a great place. She's been there for years too. So we are, you know, decent citizens, and I told them how wonderful it is, and I tell everybody. So if we could figure out how to let more people know, you know, the people that come and say what I say. I go there, I love it. They have more things for the people there. I've seen people go over there and pick up food. I saw for Thanksgiving, they were giving Thanksgiving boxes away. I'm like, where else does that happen, you know? So that's my question. How do we let everybody know? Thank you.
Thank you.
So I am a retired family physician, retired twice. Actually worked for Women's Health for a little bit when I came to Santa Fe, and then they got scooped up by, as we know, Southwest Care. Anyway, which necessitated my retiring a second time. I'm here, I know about La Familia, known about for a long time, a member of the NAACP, and I would just like to invite you all to take one more step and join the organization that I am a member of, which is affordable health care for all New Mexicans. And it encompasses community health, but primarily hospitals. I heard somebody say hospitals are broken. Well, the whole healthcare system is broken. So I'd like to invite you all to come to see a movie, October 22nd, at another wonderful church, First Presbyterian. October 22nd, we had some panels of physicians who are also have been disenfranchised, more or less, and have broken away and started Nexus, the oncologist, a wonderful oncology group that is here now. Some of the physicians have started their own organization. So I'm just inviting you, and maybe we can get together and have one common solution to it. No, it's not going to be one, but see what we are about as well. We're a consortium of 170 organizations within all of New Mexico. So again, if you have an opportunity, October 22nd, 2 p.m., First Presbyterian Church. It's about a 2-hour presentation. Join us, please. Thank you.
Rachel.
It's health care for all New Mexicans.
And that's the name of the organization, Health Care for All New Mexicans. Okay.
Okay, we're going to do Christine and then Rachel.
Sorry, I'm taking over, Rachel. So just listening to everybody, I just want to say that I have a couple business cards here. If anybody wants my email and wants to apply to be on the board, here's my info and you can contact me directly. I don't make the decision, but I'm the board liaison, so I forward it on. And I do want to say that I think the reason that I'm, pushing this is because I think the system is broken, right? It's more, all the time, even from the federal government. It's not good enough that we saw 15,000 patients last year. We got to see 17,000 next year and, all of that. So it's not just, the whole system is capitalist driven, even though we're supposedly nonprofit, right? But what we can do is change the culture. And we are not going to change the culture with a board that we currently have. And so I need you all on our board. I mean, when I'm sitting here listening to Pete Swersu and the people from Casa Familia, so every year our staff gets together and makes Christmas breakfast for Casa Familia patients. Every quarter until this new CEO came, we would get together and either raise money and go order enough chopsticks for 100 people, or we would get together and cook food. This new CEO told me, you can't do that because La Familia can't write it off. So that's the culture, that's the kind of people that have been hired to lead an organization born to help poor people and disenfranchised people. So I say the first thing that we have to do to fix this is I need you all on the board. So come get I brought 4 cards.
Thank you, everyone. This has been wonderful. And in labor, we have a clap, and I want to invite you to join me. And let's see if my brother over here remembers the labor clap. But before I want to ask you that, I want to say, whose clinic? And you say, our clinic. Whose clinic?
Our clinic.
Whose clinic?
Our clinic.
Whose clinic?
Our clinic.
One more time. Whose clinic?
Our clinic.
Brother, if you join me to do the labor clap, and then I'll tell you what the next steps are going to be.
Cesar Chavez would do this at every one of his rallies. It's called the aplauso organizado, organized applause. And we start it like this.
Thank you, brother. Thank you. Rachel, one more from New Mexico. Yes. Viva la familia! Viva! Okay.
¡Que viva!
Viva la familia!
¡Viva!
Viva la familia! Are you energized? All right, so next steps. I think it's probably going to take around 30 days to get our elected officials here. I would like to do another town hall with your okay. And let's bring our governor and the elected officials here. And in between the 30 days, we'll pick a date. We need a letter writing campaign to the elected officials. Are you in? Yes. Okay, we'll provide templates. We have your emails if you signed up. We're going to follow up with the email, share the link to the wonderful YouTube community town hall we have. Thank you, my brother, for doing this for us, and our communications manager. And I want to say thank you to DSA for being so supportive. When they heard about this, they jumped on board right away. And for Todd and Eric, who just came on board also and were helping me and continue to support this movement, because this is a movement. And this is happening all over the country, and we're doing these types of town halls with other FQHCs all over the country, because the message is the same with all the clinics that I'm organizing. So again, next steps, letter writing campaign. We'll provide a template, or you could write your own letter. Very important that your elected officials hear from you. And we'll send out an email. When we have Zoom meetings, if you could join us, please join us. We talk about different things there. And we have a name for our community group. We want to share it with everybody to make sure everybody's good, because you must have a name so that we can put it on letterhead, and we mean business, right? Right. Okay, so thank you for your time. Do you have any questions for me
from the union effort or the community organizing efforts? Yes.
Well, I came in like 5 minutes later, I don't know, but I missed your initial talk as the union rep, and I really
Rachel's a
appreciate it.
union
I
rep.
grew up in a non-union family, and at the time when I was a little kid, that was a big deal. You know, were you union, were you not union? And I feel that the union has an incredible opportunity. And we're seeing it all over. We're seeing with the auto workers, with everybody else that's gotten involved. And I feel like you stepping into, not stepping, but jumping into healthcare is so vital. And I want to thank you for getting involved. And let us know, please, you know, keep doing that. I want to know what's going on. I want to know what the union's role in this is, because I do not see it coming from I do not see this nice relationship between providers and patients and then the upper crust. I see them as that they're like asleep and that they're not worth waking up. I feel like the power is going to come from the people and from the union. So please, let us know.
All right.
Amen.
Yes.
Transparency and accountability. You know, I also heard, it's 30 days too long. And since it's federal law that the patient, 51% patient on the board, it doesn't have to be an advisory. Someone mentioned fixing the bylaws. Can we put a small group together, put a brief together on all the different moving parts and look at other venues for strategic action?
Yeah, we need a plan. And if you want to be part of that planning committee, highlight your name when you sign in so that we can put a planning committee together. And I say 30 days because elected officials' schedules are very booked. So I could be wrong. In Santa Fe, maybe 30 days is too much. But I want to be able to give them time so that they can be here. Some of you have relationships, and in between now and that next town hall in 30 days, you might be able to call or do visits. Maybe we take a group and we visit your elected official. There's important things to take these steps so that we bring them here and they hear you, because they're the ones that are making decisions and voting. They're the ones who allocate funding. And, you know, President Bussey said that, we're about solutions, and we are. We want to identify funding. We're not here to destroy La Familia. We're here to lift it up. We're here to make it better. We're here to partner with the employer and find solutions. That's what we're about, because it serves nobody any good if we come here and tear things down. We got to take the high road, and we got to, go high when they go low, as Michelle Obama said. We got to go high, right? And that's why we're here, to make it better for everybody. Yes. We did not invite any elected officials to this meeting. I've done a couple other community group meetings, and we've had community first to hear from community, and then the second meeting will be with the elected officials and community leaders and faith-based. It's very important. Yeah. Yeah.
Rachel, and that would be the point person. So I'll get ready to get phones out. Rachel can give you her email
Sure.
address.
And I'll post it on a sign out there.
Special communication, like you say.
Yeah.
Like, I really want to get the board, this is good advice for our planning committee. That would be great. So Rachel.
It's R Flores, Flores, at uapd.com. My number is 909-408-0445. And I'm here to serve. There's no better job in my mind than being a servant, a public servant. So
Thanks, Rachel. And thank you to United Church.
Amen.